Good afternoon, my name is Lorna Fern and I'm a Senior Research Fellow based at the Cancer Clinical Trials Unit at UCLH Hospitals in London. I'm the Patient Public Involvement Lead for the National BRIGHTLIGHT study, and I'm presenting this on behalf of my colleagues that you can see listed here. So we are going to have a quick look at what is BRIGHTLIGHT, our previous patient and public involvement strategy, why we needed to rapidly mobilise to online engagement, what we did and what we've learned. So BRIGHTLIGHT is one of the largest studies of young people with cancer in the world. It's set out to address the question, do specialist services for young people with cancer add value? And that was in response to this document, which was issued in August 2005, which said that young people should have age-appropriate care in age-appropriate environments. And in response to this, 13 specialist principal treatment centres were set up across England. But despite this, there was little evidence on what they should look like or their effectiveness. And so BRIGHTLIGHT set out to answer 4 unanswered questions. And that is, what is age-appropriate specialist care? What are the most important elements of a teenage and young adult service? What outcomes are improved by this service? How much does this cost the young people, their families and the NHS? And this was underpinned by an extensive patient and public involvement strategy since 2008, which was prior to the funding of BRIGHTLIGHT in 2011. Because we felt that a study about young people with cancer should be designed and run by young people with cancer. So if we look at our previous patient and public involvement strategy, you can see that young people were involved in the feasibility work. They were involved in setup of the study, execution of recruitment issues and retention difficulties. They have supported us with data analysis and identifying new research projects, and they also helped with dissemination. And so key to that research, that patient and public involvement strategy, is an annual face-to-face workshop with our young advisory panel. And that's also supported by patient conferences and then the dissemination via the arts-based performance there is a light. So in total, we've consulted with approximately 1,200 young people and their carers over the past 15 years, which is similar to the number of young people recruited to the study. So if we have a little look at some of the young people who've been involved, we can get a flavour of what our PPI workshops are like.
Welcome to BRIGHTLIGHT. We've had a really good day today. We've met lots of great people and it's been wicked. We've made lots of friends, other people that have had cancer, and we've done a lot of research in the day to help other cancer patients.
Hi everyone, my name is Jason and we're here at the BRIGHTLIGHT workshop. I spend a lot of great time with these people here. We're brainstorming about different ideas of how to help other young people at the same time, those people diagnosed with cancer. And it's just fun, so you should come and join us.
Today was really, really awesome. Met great people, had cancer just like we were able to talk about different things. We did a lot of research, we came up with good ideas. Come and join us next time. Woo!
Okay, so no social distancing, no masks, lots of singing, a bit of dancing, nothing which you were able to do from March 2020. In March 2020, we had actually planned our final results workshop. It was going to be a 2-day event in London. The invites had gone out to young people and we were all quite excited about it. And the critical reason that we really needed their input was that the results that we got from BRIGHTLIGHT were quite confusing for us as researchers. And so we really needed the young people to try and give us some insight as to what they thought was going on. And in addition to that, we just had some funding from Cancer Research UK, which had asked us to do an additional PPI workshop prior to the study starting. And then obviously mid-March, we were all instructed to stay at home and neither of those things were possible. So a few years ago, we published the 7 Ps of PPI, and here we were in 2020 identifying another 2, P for pandemic and P for platforms. So what social media platforms would we be able to successfully run our workshops on safely for young people? So we managed to do 6 online workshops between June 2020 and March 2021. Invites were sent out via Facebook Messenger, which was really successful. Each workshop was attended by around 9 people, which was quite a good number given we did so many. The sessions were approximately 2.5 hours with a break. An artist animated focus group discussions and results and helped to create some packs to send out to young people prior to the workshop. And each workshop would have 2 facilitators and 2 safeguarders, which was really important because it was harder to read the room as a facilitator during an online workshop. And we also, as standard from our previous strategy, would follow up for distress by, I would do that. So this is a snapshot of one of the workshops, not as exciting as the dancing around in the room, but still as effective in many ways, I think. You can see there the 2 researchers, myself and Rachel Taylor, and here is Luke Hughes and Annika Petrelli, who are our safeguarders for that particular workshop. Our first workshop was done on MERO, and you can see we were very enthusiastic. We put together some packs to send out to young people, which contained an information sheet, an online workshop conduct policy, consent forms, contact numbers for young people, and also for somebody else who had access to where they were doing the online engagement, just in case anything happened to them and we were unable to get to them. The activities that they could do beforehand, an evaluation form, a demographic form, stamped envelopes, and even some snacks for workshop 1. In terms of outputs, you can see on the right-hand side, the smaller square in the middle is the sheet that was sent out to young people for them to animate themselves or write on their diagnostic journey. And what you can see here is the cumulative stories that the artist has drawn out as I was facilitating the workshop. The activity in the middle was also sent out to young people where they could think about what areas of their life were still impacted by their routes to cancer diagnosis. And then during the workshop, they could transcribe these onto the MERO interactive board, which is what you can see there on the right-hand side. So when we had a bit of a discussion about MERO, although it worked well, we couldn't see everybody's faces and the young people didn't like that. I was kicked out quite early on. We weren't sure if that was because of the app. The session had ended abruptly and we didn't feel particularly happy. Well, we didn't feel particularly happy about that, given that we were in the middle of a conversation. Young people requested more time to talk. And also young people had asked if they could have it on Zoom. So if we fast forward to workshop 6 to give us an idea of how streamlined we became. So we used the Patient Secure Zoom app from UCLH Hospitals. The artist animated results while the researchers spoke, so there was no graphs were presented. And we used a Google Jamboard to do a post-it note exercise. The pre-workshop materials were streamed down and given out online. There was no physical pack sent out unless young people requested them. So there'd be the consent form, contact phone numbers, information sheets, and a Zoom agreement form. So our outputs for workshop 6. So here is our diagnostic intervals that we looked at. These are the outcomes that we measured. And here on the Google Jamboard is what young people would want to do with the results now. So in terms of outputs from the online workshops, they were of good quality and really useful. So what we learned, there were some drawbacks to doing that online. It's very resource intensive in researcher time in terms of preparation and preparation for the artist. Safeguarding of young people is definitely more difficult. And we did have one occasion where young people had become upset. And one of the observers had to contact me to say, because I actually hadn't noticed. The peer-to-peer support for researchers is also difficult. It's important to support young people, but I think as a researcher, when you're doing patient public involvement, there is also an impact, and it's also good to have your colleagues physically in the room with you. And young people did say that although they enjoyed the workshop, they missed meeting each other. However, there were positives. So we managed to rapidly mobilise our PPI to online activities. We had to think about new ways to present complex data, which was a learning experience for us. There were no travel or venue costs, which meant that we could do more workshops at shorter notice because we didn't have to book things. And we also had more funds available to pay young people for their time. And it was definitely more accessible to young people. There was less constrained by work, so they could join after work. They didn't have to travel to London. Some young people joined when they were in isolation. And we also had two young girls have their first baby during lockdown and brought them along to one of the workshops. So there were definitely positives. So we'd like to acknowledge the BRIGHTLIGHT team and the EDAC research team for all their support over the past 18 months in delivering these online workshops, all of the young people who participated in BRIGHTLIGHT and all of the YAP past and present. And we also have an acknowledgement there from the NIHR to say that the views expressed are those of the authors and not necessarily those of the NIHR or the Department of Health and Social Care. So thank you very much for your time, and I'm happy to take any questions.